This video module has been created to demonstrate how to document as a student nurse in the Cerner electronic medical record. This education will review the documentation elements that do not require an RN signature, as well as those nursing documentation activities that do require an RN signature. We will review exactly how to perform this documentation as well as the co-signature requirements. The first thing we're going to do is choose our patient name from the patient list. We're going to double click on the patient name. You'll see this comes up with a box that says assign a relationship. If you use the scroll bar on the right, you can look at all the different schools that are represented. You'll choose the appropriate school that you go to. For this case, I'm going to choose other school here, and I'm going to click OK. This will open the patient's chart. You'll be able to open it up, take a look at the patient. The first section we're going to look at are elements that do not require an RN co-signature and how to find those in the electronic medical record. Once you're in your designated patient's chart, in order to get to the ad hoc student nurse folder to document elements of basic patient care that do not require an RN signature, you will look at the toolbar, the top of the chart, and look for ad hoc. Double click on the ad hoc. You should see that you're in a student nursing folder. You will see three different elements here: vital signs form, basic patient care form, and I&O. We're going to begin with the vital signs form. Click on chart. It will open up a form where you can enter all of your information. Let's say this patient has a temperature. We're going to enter that. The temperature route, we took an oral temperature. This patient's pulse rate is 120. And let's say we counted out those respirations and they came out to 22. Took a blood pressure for this patient. It was 140/74. We took that blood pressure in the left arm and they were lying down when we did that. If we were to assess this patient's pain, they reported their pain as a 3. Their pulse oximetry when we checked it was 98%. Do not have an end-tidal CO2 monitor on. This patient is on room air, so we don't need to document any FiO2 over here. For the AVPU scale, that stands for alert, voice, pain, or unresponsive, we're going to assess this patient to see how alert they are. This patient happens to be alert and easily arousable. So to document on this form, once we've entered all the fields we want to enter, we then go to the green check mark above, and we're going to click on that check mark, and that will document this form into our medical record. If we wanted to go back in and look at the vital signs that we had entered, we could go over to the menu bar here. Under iView I&O, you click on this. If you look over here at the vital signs, here are our results that we just put in. You're able to look and see at all of your information that you've entered into the record. Okay, let's try this one more time. Go back up to the toolbar, click on ad hoc. This time we're going to document some basic patient care. So we're going to click on basic patient care and click on the chart button. And let's say we helped give this patient a bath and did a lot of personal hygiene with them. I'm going to go through and choose all of the elements that are appropriate. Let's say we helped this patient brush their teeth, comb their hair, and wash their face, and they needed a little bit of assistance from us and one person to help them. Let's say for this patient they have a central line, so they're going to get a chlorhexidine bath that we helped them with. We're going to document that. And then we put them back into a clean patient gown. And we also did catheter care, mouth care, changed the sheets on their bed, and gave them a back rub. Doing a great job today. Then we can go back up, look if there was anything else that we needed to document up here as far as toileting or activity and mobility. We could document those elements as well. Once we're finished with this form, then we can click on this check mark to document this information. The next section will address documentation that requires a co-signature from preceptor RN or a faculty member. Next, we're going to look at those documentation elements that do require RN supervision and an RN co-signature. Elements that are documented in this way must be co-signed before the end of the clinical shift, must be validated by an RN who is supervising and validating the accuracy. You should discuss this with your preceptor or faculty member before documenting to make sure that they have the time and the ability to go in and co-sign the documentation. This is for legal purposes. So we're going to begin with documenting a physical assessment. We're going to begin for this patient with a gastrointestinal assessment. Anytime you're documenting to make it easier on yourself, if you double click in the column of whatever the category is, once you double click into that category, it opens up the entire category so that you can tab through and make it much easier on yourself. So for this patient, let's say we want to do a detailed assessment for this patient. If everything is within normal limits, we can document by exception. We can say within normal limits and don't have to enter anything else in the documentation. This patient, we're going to go ahead and document a detailed assessment. So we're going to click on detailed assessment. Each time we click on a box or hit the tab button, it should directly take us to the next field. So for this patient, we're going to document this patient has a slightly distended abdomen that's semi-firm. We're going to hit the tab button. It's going to take us down. Abdominal tenderness, it's generalized, let's say. Hit the tab button. Do they have bowel sounds? Ooh, they're pretty hypoactive. We're going to click that. If the patient has had a stool, we would be able to document the assessment of the stool description. If we haven't seen a stool, we can hit the tab button and move to the next. Are they having any kinds of symptoms? So we're going to go ahead and say this patient's kind of nauseated. Hit the tab button, take us to our interventions. What are we trying to do for this patient? Have we done anything different? So this patient, we're trying to walk and try to get their belly to wake up. So we're going to hit activity. For this patient, we hit the tab button. This is for gastric residual for feeding tubes. Let's say this patient doesn't have a feeding tube. We don't have to enter anything else into that information. Okay. So for the next one, let's say that this patient, we're looking at their genitourinary tract. Let's say for this one, everything is within normal limits and we don't need to document anything else on this patient. So we can just skim through all of that information there. Once we are done documenting our physical assessment, we go to the green check mark again. We're going to sign this documentation. Now remember, we don't document a physical assessment unless you have verified with your RN preceptor that they are going to validate and co-sign your information, and you have to watch them do that and validate that it's actually being done. Or if your RN faculty member has time to go in and validate the information, you can do that as well. So we're going to go ahead and click this check mark. And then what I want to show you is what this looks like when a student nurse has documented in the medical record. You can see that there is a green check mark, but there's also a little red hash mark across this. This is how we know that this information was documented by a student nurse and has not been validated yet in the medical record. So this is something you can look for so that you can see if things have been co-signed or not. And then we will go over in a little bit. I'll show you from a staff nurse or faculty member perspective where to look to see if you need to validate something. So that is the basic physical assessment. The next thing I want to show you is regarding dynamic groups. These are elements that you would document if you inserted an IV, if you inserted an NG tube or a urinary catheter, or were assessing those elements. These are all things that you'll find underneath your iView band in whatever area that you're in. You'll see them labeled. We're going to go here and look at peripheral IV. You click on peripheral IV, and let's say you were lucky enough to get to start an IV on a patient, and now you get to take credit for it and document that peripheral IV. We want to make sure the dynamic group is completed so that we can continue to assess that IV and know when it was placed and when it needs to be changed. So we're going to double click here and open up this to create a label. So let's say for this patient we put their peripheral IV in their left, and you were really super good this day. You could put in an 18 gauge, and let's say you did it within your nursing unit. You can put nursing unit right there. And then the insertion date and time. So we can do the trick of type in a T, and that puts in today's date. And then if you needed to, you could change the time a little bit if you're documenting after the fact. So we've got all of this information put in here that we need. We're going to click OK. And then we're going to go ahead and assess the site. Since we're here and we're looking at it, it's hopefully, since we just put it in, dry, clean, and intact. And we'll hit the tab button. No current complications for this IV site. And we've got this on a smart pump. And you know what? Since we just started this IV, we put a new PRN adapter on it, and we also started new tubing there. So we're going to go ahead and take credit for those activities. Phlebitis scale, hopefully it's a 0. And we're going to go ahead and put that we started the IV so that when we look back at documentation, we know that we were the ones who started that IV. Because you're star nursing students, you did that with just 1 attempt. So you're going to take credit for that and put 1 attempt. Once you've entered in all of this information, if you see this is all still purple, that means it hasn't been signed yet. You haven't signed it. So we're going to go up to the yellow, or to the green check mark and click on sign. That turns everything black here, and then you'll see again your green check mark with your red hash mark so that you know that this is student nurse documentation. Next, I will take a second to just show how to co-sign documentation so that faculty will understand what to do, and student nurses, you may have to teach your preceptors what to do. So when you look up here, you see this very tiny check mark with the red hash marks. This is the symbol that something in the medical record needs to be co-signed. You'll see it's still over here, all of the documentation. So if you click on this, it opens up all of those things that you've documented. So if you go through, and as the RN preceptor or faculty member has also assessed the patient, reviewed the documentation, or they feel like this is an appropriate documentation and assessment, they can go through. You can authenticate everything and just hit sign. Or if there's something where you want to go back and say, I need to go back and reevaluate that, you can uncheck one thing or you can uncheck multiple things and go back through. Let's say for this assessment, we agree with the entire assessment. We saw the patient as well, feel like this is all appropriate documentation. We're going to go ahead and sign this documentation. Click on the sign, and then you'll see our symbol went away, and also this is grayed out up here. The authenticate button is now gray, so that means everything that's in this record has been authenticated. It's been co-signed, so we don't need to worry about that anymore. So that is the how to validate and co-sign documentation. On the task list under scheduled medications, tasks for medications will say pending validation. In order to validate medications from this list, right-click on the medication and continue to validate as usual. For PRN medications, on the PRN tab, look for the yellow symbol on the far left side. This will also say pending validation for PRN medications. PRN medications must be validated before the medication can be given again. It will not show up as available until the previous dose has been validated. You can also validate medications by looking at the MAR. Right-click on the pending validation box to validate the medication from this view. To summarize, elements that do not require a co-signature are those things that could be documented by a nursing assistant, such as vital signs, basic patient care, I&O. It's found on the ad hoc button. To summarize, elements that do not require the co-signature that are documented from the ad hoc function in the nursing student folder are documented on forms and then are found on the iView tab. Another example of documenting bathing information from the ad hoc form that is then found on iView. To summarize, when you have something in the EMR that needs to be co-signed, you will see the green check mark with the red line across it. That means there is something documented that needs a co-signature.